Today, we'll explore the 13 key provisions that make up the landmark Washington Health Trust Act. Senate Bill 5233. This legislation represents a comprehensive blueprint for transforming healthcare in our state. Provision 1. Universal Eligibility for All. This bill guarantees that every single Washington resident is eligible for coverage. This includes non-resident students, workers employed in our state, and their families. Healthcare becomes a right of residency. Provision 2. Truly comprehensive benefits. The coverage includes everything medically necessary: hospital care, primary and specialty doctor visits, prescriptions, dental, vision, mental health, and maternity care. Crucially, for most residents, there are no premiums, no deductibles, and no copays. Provision 3. Public board governance. The system is governed by a 17-member public board of trustees, including health experts, consumer representatives, labor, business, and tribal voices. 3 standing advisory committees ensure ongoing public and professional input. Provision 4. Smart provider payments. The bill moves away from chaotic fee-for-service billing for major providers. Community health centers and hospitals can negotiate predictable global annual budgets, letting them focus on care, not paperwork. Telemedicine and mental health services get payment parity. Provision 5. Drug price negotiations. The trust uses the collective power of over 7 million Washingtonians to negotiate fair prices for prescription drugs and medical equipment annually. An evidence-based formulary ensures access to safe, effective, often generic medications. Provision 6. The fair financing structure. Funding comes from multiple, equitable streams. Employer contributions are scaled by business size, from 4.5 to 10.5%. There's a small, capped 2% employee deduction, which employers can choose to pay, and a modest adjustment to the existing capital gains tax for high earners. Provision 7. Ironclad anti-discrimination. The bill contains some of the strongest non-discrimination language in the country. It bans discrimination based on pre-existing conditions, income, immigration status, gender identity, sexual orientation, and body size. Culturally competent care is mandated. Provision 8. Integration with existing systems. The bill thoughtfully works with current programs. It seeks federal waivers to integrate Medicare and Medicaid funding. It fully preserves veterans' benefits and tribal sovereignty over Indian health services. Supplemental private insurance remains an option. Provision 9. The phased implementation timeline. This is a responsible, staged rollout. The board forms in 2026. Enrollment begins in 2027. And the system targets full implementation by 2029, with long-term care benefits added that year. Provision 10. Strict cost controls. The bill has built-in fiscal guardrails. Administrative costs are capped at 7% of the budget. Annual independent actuarial analyses and state performance audits are required. Multiple dedicated accounts ensure transparency and solvency. Provision 11. Transition support. The bill provides a fair transition. Union-negotiated health plans are protected until new agreements are reached. A dedicated displaced worker. Training account helps retrain those in the insurance industry. Employer spending requirements phase in gradually. Provision 12. The Health Options Program. For residents not yet enrolled in the trust, a safety net exists. The Health Options Program provides community health access to essential services for the uninsured and medical reimbursement accounts for out-of-pocket costs. Provision 13. Key implementation triggers. Specific milestones guide the process. A major provision triggers when 60% of residents are enrolled, or by April 1st, 2029. Annual reporting to the legislature starts in December 2026, and federal waiver applications follow strict deadlines. These 13 provisions together form the Washington Health Trust, a detailed, practical, and just blueprint for healthcare in our state. It is economically sound, morally right, and within our reach. Thank you.